All right. Welcome everyone to our Parent and Family Services Tiger Talk. Woohoo! We have a very special Tiger Talk today, supporting your student, a holistic approach to student wellness. And we've got two of our campus partners here from Student Health and Counseling Services. And I'm going to let them introduce themselves and then get right into the information. We will have a time at the end where we'll answer some questions that have been submitted. But if you have a question during this session, please feel free to put it in the chat and we'll make sure we address those questions as well. And if you're watching this later on our YouTube channel, then you can ask your question by sending it to parents@memphis.edu, and we'll make sure that either if we can answer the question or we can get it to the Counseling and Health Center so that they can give you a response that way. But we thank you for joining us either way. And so let's get into it.
Well, hi, parents and loved ones. My name is Victoria Jones. I'm the Assistant Director of Outreach and Prevention Services, and this is my new colleague.
Hello, I'm Madison Yancey. I just joined the U of M team about maybe a month ago. I'm loving it so far. I'm a nurse practitioner. I work here at the campus health center.
All right. And
Us.
I didn't even introduce my own self. I'm sorry, y'all. But I'm Heather Hampton, Assistant Director for Parent and Family Services.
Hello, everyone. My name is Cade Forbes, and I'm the coordinator for Parent and Family Services.
So I know parents are eager to get into the information and find out how they can support and support their student, basically mental wellness, all around wellness, health, spiritual, because we want our students to be successful and they can't be as successful if they're not well. So let's get into that. I'll stop sharing my screen and yield the floor to Victoria and Madison.
All right. Let's see. All right. How's that look? That look okay? Okay, great. Let me scoot this over here. Oops. Just want to be able to see y'all too at the same time. So let me see if I can. Okay. We're gonna forego seeing y'all for right now. So if there's any questions that come up, just alert us while we're going through this. So today we're here kind of to talk about a holistic approach to student wellness. So what that looks like and kind of addressing all different areas. So we know that at any age, that satisfying life balance can be hard to maintain. And we know that like balance is kind of a arbitrary thing, right? Like you can't really have everything be even all the time, even though we'd like it to be. So we use this wellness wheel a lot in our other stress management or outreach activities to kind of like have people assess what they are feeling. So just to kind of briefly go through right now, so, for you to kind of check out as a tool for you just to like assess it where you are in satisfaction. So sometimes it's just like, hey, like how am I feeling in each different area? Because sometimes like the wheel will still rotate even though it's not all even. So we kind of like to stress that too, is that sometimes going at it from a holistic approach. So what needs most attention right now, because we can't always be focused on all of them at the same time, but we can emphasize what we need in a certain amount of time. So I take some time. You can pause this if you're watching this later on for you to kind of debrief for yourself. But this is just like a nice activity just to, one, start off your year, start off your semester, even like mid-year, maybe talk about with your student to kind of, make sure that they are like thinking about all these different areas because they will affect each other at some point as well. So like I said, it's about finding balance, and that's really what we promote. And that's why we also like to engage with so many of our campus partners to make this from a public health approach that student wellness, mental health, physical health isn't just like from our offices, it has to be translated across the campus as well. So big thing we wanted to, talk about today is like that mind-body connection. So obviously we have me and my colleague Madison to talk about from our perspectives in our varying fields. But we know that people affected by mental illness have higher rates of other serious health conditions, and about 7 out of 10 deaths are caused by chronic diseases that can be prevented or better managed. And so within this 18 to 25 age range, it's really important to start getting an understanding of your health, right? So knowing your health history, knowing, genetics and things like that, because this is a good time to learn about it and then start making those behaviors to prevent it before you graduate and go into, your next season of life after your student, is no longer at the university. This is just that good time range based on development and research around the brain as well. So another thing too is that about 44% of people who have depression, 40% have a higher risk of developing cardiovascular and metabolic diseases than general population. And Madison kind of will explain that in a couple slides. Rates for obesity for people with serious mental illness are about double the rates of the general population. And that we know that people with serious mental illness have twice the rate of type 2 diabetes. And then really the whole, concern is too that if we're not thinking about health and wellness from a holistic approach, we're really cutting out our lifespan too, because these other issues can co-occur with other things. So like 10 to 20 years of a shorter lifespan that have cardiovascular and serious mental illness, like it's kind of a scary number to think about too. So we want you all to be talking about this, with your students and, just to be thinking about it, to take control of and be knowledgeable of your health as well. So a couple other things, like thinking about your goals too. Obviously, advocating for your health is really important, especially like teaching your student that. Like you may have been the one to always kind of, make appointments or keep the health records and whatnot. I think it's really a good learning opportunity to begin to let them start doing those types of things and like understanding what their health is so they can ask their provider question or whatnot. Obviously getting regular checkups, which is something that you can, use our services for just to, know in the medium, but like long-term wise, having, those primary care physicians is really important, and primary care providers like across the span is good. Communicate with your treatment team. So one big thing is like knowing what your medications are and what they do, writing it down in your notes app, whatnot. And there's lots of other things that you could do with like your tools, right, to help improve those conditions. And not just self-medicating with harmful substances. So we want, those good behaviors to come through. And then like lastly too, like making those connections, right? So you don't have to tell everybody your business or anything, but you can definitely be informed and, let people know so that you can have that like accountability and other people, knowing what you are trying to achieve so that they can support you. So one thing that we have talked about too is that really what gets overlooked a lot of time is gut health. And I'm going to turn this over to Madison to chat a little bit more about why this is kind of important to begin exploring, especially at this age of our students.
Mm-hmm. So piggybacking off what Victoria said, gut health is very important. It is overlooked. The heart, the lung, the brains kind of take over the spotlight when it comes to health, but you are what you eat. What Victoria was saying about type 2 diabetes and metabolic syndrome, if you're eating a lot of greasy, fatty foods, sugary foods, it will contribute sometimes earlier, sometimes later, sometimes midlife, but it will catch up with you and it'll contribute to chronic diseases. So the overall health of your gastrointestinal system is very important. Like I say, you are what you eat. Watch what you're putting in your body. A healthy gut is supported by eating fruits, vegetables, prebiotics, and probiotics. Those are simple things that we have learned from, a young age, but, it's so simple, but, it's hard to do sometimes. But even if it means having to prepare your meals or shop, for everything on a Sunday and have everything laid out for the rest of the week, those are healthy habits that you can develop now that will pay off in the long run. So signs and symptoms of an unhealthy gut, you might have some constipation. You might go 3 or 4 days without having a bowel movement. That's red flag number one. Diarrhea, running off at the bowels, just having very watery, loose stools. Something is wrong. Sometimes with that diarrhea, you get abdominal pain, and sometimes you just have abdominal pain in general. So those are red flags. as well as a very common one, acid reflux, aka gastritis. A lot of people have that heartburn. You know, you might go to a football game on a Friday and eat pizza and wings, and you lay down and like, what's that stuff coming up in my throat? That's acid reflux. That's heartburn. A lot of you can't just, you know, be expecting to eat pizza and wings all the time and then think that you're not going to have any kind of issues. And also excessive gas. If you're having a lot of flatulence, you might want to take a look at what you're eating in particular and see what's going on. So, of course, like non-fatty meats are also a good thing to incorporate more into diet, meaning not fried chicken, baked meats. Of course, putting meats on the grill is good as well. Fish, turkey. So those kinds of meats are also good to kind of help out with gut health. Irritable bowel syndrome is a condition that of the abdomen that is categorized by stomach pain and alternating changes in bowel routine. So meaning constipation and diarrhea, but more so with irritable bowel syndrome, you'll see diarrhea. A lot of people, you know, anxiety can precipitate, precipitate changes in bowel habits. So as far as like connecting the mind and the body, if you're feeling anxious about something or having, you know, stress about something, it's the body's natural reaction to want to empty the bowels before you go into war, per se. So, you know, you might feel, you know, if you're feeling anxious, if you got a lot of stress going on in your life and you eat something, you might be going to the restroom more often, and, you know, you might have the stomach cramps and, you know, you don't know what's going on. So if you are having like stomach pains and diarrhea, just think about what's going on in your life. You might be studying for a test, and right after the test, everything is fine. You might be, you know, getting ready for a speech or something, or, you know, getting ready to have a stressful talk with your parents. If you're a student that I'm talking to, if you're going to have a talk with your parents or your teachers, you might, you know, some anxiety and stress will manifest in your body sometimes. And sometimes that comes out as diarrhea or constipation, and it's known as irritable bowel syndrome. So that's pretty common, and a lot of students, people in general, deal with that.
Yeah.
And so what I have here is the Bristol stool chart. So as I was saying earlier, these are abdominal things to look out for. Constipation, less than 3 bowel movements per week. So type 1, that's separate hard lumps. There's things to look out for if you're having a bowel movement, if you're having some issues. Type 2, it says sausage shaped but lumpy. So, I mean, it's better than 1, but you might definitely need to incorporate some more water in your diet. Definitely more fruits, watery fruits, watermelon, oranges, apples, things like that. So type 3 is probably where you want to be. Somewhere in type 3, it says like a sausage with cracks on the surface. So that looks like a nice formed stool. That's what you want. 4, you might be getting into having a little bit more of it's a smooth, soft bowel movement, which is fine too. But with type 5, it says soft blobs and with clear cut edges, that might mean you have a little bit more too much grease in your diet. So if you're eating a lot of like steaks with a lot of fat on it, you might want to cut that fatty part out. Or if you're eating stuff that's just not agreeing with your system, it's just going to come straight through. That's 5, 6, and 7. So you definitely don't want those. That 7 is water. It's just like taking a cup of water, just pouring it out. It's really something wrong. So that's when you come to us and we try to figure out what's going on.
And this could be stressful too, right? So obviously we're not just talking about bowel movements as it, you know, occurs, but this is something that sometimes people don't recognize, right? They think it's just like, you know, oh, it's a health issue or whatnot. It could be other things like we talked about, like anxiety too. And so it's good to like something that you can take control of is, you know, thinking about what you're eating and how you're managing your stress.
Right. So, of course, the stomach kind of takes the backseat when it comes to the heart, the lungs, and the brain, but they all kind of run together. I have control your health here because on the right side, exercise, eating healthy, getting adequate sleep, controlling stress, and avoiding smoking. All of those are things that you can control. Things that you can't control are genetics. some stuff that you're born with. So if you have a family disposition to have high blood pressure, these are things on the right side that you can do to prevent high blood pressure. I'm telling you, exercise does help. I've seen patients, they come in with elevated blood pressure, they start getting on a good exercise routine, 30 minutes of walking a day, and their blood pressure comes right to a good level. So healthy eating, of course. Eating fruits and vegetables, it might not be the easiest thing to do all the time with all of the fast food places that we have. And I say, there's nothing wrong with treating yourself every now and then, but, say, okay, I'm going to reward myself with maybe some fast food, after you've like worked out consistently and ate healthy for 4 days straight. Maybe you want to get a piece of cake or a milkshake or go to Taco Bell or something. Nothing wrong with that. Getting adequate sleep.
Madison, can I jump in right quick? Because one thing that I noticed, like, there may be some families whose students have a meal plan, or maybe you eat on campus. And so just talking to your student about the choices, because I know there's healthy food on campus because I see it. But then you see the students running to the hamburgers and hot dogs and the pizza every day. So just encouraging your student, whether they have a meal plan or not, to maybe choose some healthy stuff, choose some of the fruit cups and the whole fruits and salad and things like that every now and then. I think that's something that you can remind your student of.
Right. Absolutely. And it's hard because, like, these are like addictive type of things, right? So like the sugar and the, salt and things like that like are comfort foods, right? Like they literally they program our brain to want more of it because of the dopamine and serotonin that like we get from that as well. And it's, it makes us feel good or whatnot. And so in moderation, obviously, is really helpful, but it is hard to find, other things that you like that are healthy, but sometimes it tastes like that exploring thing. I was gonna mention this later too, but yeah, like talking to the U of M dining dietitian, I think is great. We have you have totally access to that. Like, how do I navigate the U of M dining system with or without a meal plan? We have a great resource of a registered dietitian that sees students for nutrition consults through the wellness center on campus as well. I think that is such a, amazing thing to have access to, just to learn more about, what goes in your body and taking charge of like nutrition and cooking and stuff like that. So yeah, definitely check that out and encourage your students to check it out. Because even if you don't have like necessarily like, issues around like your eating behaviors or like disordered eating behaviors and like things like where we kind of get into like mental health concerns about our eating behaviors, I think it's good to know, like, just for yourself to learn a little bit more about nutrition because it can really be a life changer.
Yes, definitely. And I know, we're talking to parents and students, and now's the time where students are leaving their parents' house and becoming more independent. And that's why I have up there again, control your health. It's time to start thinking like an adult and controlling your life. You know what you want your life outlook to be. And so you have to incorporate these have to start laying the groundwork for these healthy habits. Controlling stress is a big one. I know like with tests and everything coming up and, you might come to this new campus and not know anybody. And it might be, you might face some stressful situations, but deep breathing, drinking water, getting sleep, all of those things contribute to controlling your stress. And definitely avoiding smoking. Cigarettes, the studies are out there as far as the dangers of nicotine. It can wreak havoc on your lungs, can cause mouth cancer, throat cancer, lung cancer. So that's just things, you don't want to start something if you know that you can't finish it. I know nicotine is very addictive and it's a hard habit to kick. But we do have resources here if that's something that, the student or the parents might want to, look at.
Yeah. And vaping too. I mean, same type of principle now. I know that's more available for that, for folks to be, utilizing that too. So yeah, thank you, Heather, for pointing that out too, that there are ways, there's a lot of resources. So a few tips from each kind of center, because Student Health and Counseling Services is comprised by like a variety of our departments. So we're one department, but we have 3 different buildings and services. So Health Center wanted to give a couple tips for sure.
Yeah. So as far as coming to us, like what we do, We see like acute care things. We don't see really just chronic things. We don't really offer the vaccines. We do take the students' information as far as vaccines. We do the yearly flu shots. We do definitely do those.
Mhm.
We test for COVID, flu, strep, those types of things. We test for TB. And we see common colds a lot. We see a lot of STD, STI testing. We manage those, and we manage just other things. Some people, might cut your finger or something, come on to us.
Yeah.
As far as maintaining a healthy weight, that's when exercise comes in, and diet. Now, a lot of people don't say they don't have time to exercise, and that's fine. You can maintain a healthy weight with diet, controlling your diet alone. And that's just, not eating so much of the junk food, not snacking all the time, and just having a good relationship with food.
Mhm.
Drinking plenty of water, of course, I feel like that's a no-brainer, and it's so easy to do. I know sometimes in the colder months it's harder to drink water, but there are things that you can do to help you drink water. You can buy those big jugs off of Amazon. You can go to Walmart. They even have the little flavor packs you can put in your water to help you drink it. If that's something that you need to do, that is something that it's out there.
Yeah.
Mm-hmm.
So there's a lot of things to manage your stress as well that Madison was kind of referring to, because it can be hard, right? In this day and age, we have so much information out there and whatnot. So these are just kind of a few tips that I won't go through every single one of them, but I do, invite you to explore, what this may look like, right? Because I sometimes think that we can feel kind of really overwhelmed with like just the possibility of things, but I think getting some grounding with like, oh, I do have choices times, and like practicing, and it's not going to be perfect all the time, and having a variety of things to help manage your stress. So one of those things can be coming to the relaxation zone. So if you've never been before, parents, I hope that if you were on campus for Parent Family Weekend, I hope you were able to join us at the relaxation zone. But making your own RZ at home, which I'll show you in a second, figure out what self-care looks like for you. That could be just a corner of your room being, really a Zen spot, or a quiet bench that's on campus. Just, finding what works for you and making those coping skills like work for you. So these are some things that I'll leave. And if you want to pause this video just to take a look at it, this is also something that we can send out later if you need it. But relaxing sounds, comfortable seating, mindful activities are really like, a big part of like your atmosphere. So when you think about even like the dimension of wellness of having environment, sometimes like our environment is the biggest thing that will contribute to our mental wellness as well, our emotional wellness, because if things are chaotic or not clean, or we feel kind of all over the place, sometimes having just a little bit of something organized and clean and like maintained can really start then those behavior activations to keep going and have more control, in the situation when we feel kind of overwhelmed. There's lots of different types of coping skills too, if you didn't know. So sometimes we want to distract. So that could be, conversations or watching TV or doing some kind of gardening. But sometimes I know we have a tendency to kind of go to like what's easiest. So scrolling on our phone, or, taking a nap or whatnot. But there's lots of different ways that we can have different types of coping skills. So that's that there. And so again, we'll link this, some of these to our website, so you can have it afterwards as well. Sometimes we need to let our emotions out. Sometimes we just need to take care of ourselves. We can't pour into other people if we don't pour into ourselves. So again, making sure that you're prioritizing that too. It's like the announcement they always do on airplanes, right? Like put your oxygen mask on first before you help other people. That's why we, let, babies cry sometimes to self-regulate. We have to like learn to do some of that for ourselves, because we can't always rely on other people. We can coexist and be there, but we can't always just be completely dependent either. Challenging those negative thoughts and then accessing your higher self. So that could be, religious based, spiritual based. It could just be being out in nature, but it's focusing on something bigger than yourself, right? Like we are one person amongst all these people in the world. Like other people are probably experiencing something similar. Just finding that connections can sometimes feel less alone too. So we are at the end and we'll reference a little bit later, but I'm gonna stop sharing now for the question portion of this. So those were just really some tips that we wanted to give a really quick snapshot about all the things that really you can do, and that there's not one size fits all. And we'll have all these resources. If you haven't seen already, they'll be tagged on the video today as well. So you can reference and then reach out if you have other questions.
All right. Well, thank you so much for all those great tips. I'm taking notes for my own self too, so I appreciate you both. We do have, as I mentioned before, some a few questions that have been submitted, and some that we've gotten, periodically from a lot of parents asking the same type of questions. So we felt the need to ask those. So my first question, how can families recognize early signs of wellness challenges in their student?
Yeah, go ahead. Yeah.
I mean, as far as early signs, if your student is not maintaining the same relationship that they've had with you previously, if they're not talking to you as much, if they're, secluding themselves from you, I would say that's some warning signs. Changes in eating habits. Maybe they've lost more weight, very fast, like fast weight loss without trying, or gaining a lot of weight, very quickly. So I think those are some warning signs.
Yeah.
Mm-hmm.
I think another thing too, like your child too. So sometimes without being saying like, hey, this is going on, noticing, sometimes like opening the conversation, right? Sometimes when we're in a state of distress, like sometimes that being pointed out when we're trying to hide it, right? Not trying to burden ourselves. Like sometimes like highlighting that change can make us feel too seen, right? Or too vulnerable. So sometimes approaching it like in other ways, right? So like that slow roll, like let me ask you about this and this. And it's like, hey, like, so, I just want to let you know, like, reminder, I'm, always here for you and whatnot. Like, if something changes, I hope you let me know. And sometimes you got to let them come to you. And I know that's hard, right? Like, as a parent myself, like, sometimes it has to be, unfortunately, on their terms a little bit to have that communication go. But I think, yeah, the change in behavior is always the thing that we notice the most first. And sometimes just coming at it with concern, be like, hey, I love you and I care about you. And if I can do anything to help, like, let me know. I'll do my best too. So sometimes just like having that care approach is a good thing to look out for, to answer the question of like, what do you do then if something's changed?
Awesome. Great answers. Alrighty. Our next question says, what should I do if I believe my student is experiencing a mental health emergency, especially when they are so far away from home?
Yeah, especially if they're far from home. I know that can be like a challenge, like, okay, what do we do and whatnot. So our counseling services are available for all like currently enrolled students. So one, like encouraging students to come to the counseling center. We have in-person and virtual services. So on our website, students can click on our virtual waiting room to get set up with appointments. If it's ever outside of our walk-in hours, which are 10 to 3 Monday through Friday for our first time appointments, sometimes parents can call our Tiger Care line when it's after hours if they're concerned to get a consult. You can also submit a report to the Dean of Students Office at memphis.edu/report just to get our behavioral intervention team to do a little bit of support for the student as well. But during the daytime, you can always tell them to come to the counseling center, click on the counseling center waiting room to get set up with services. We also have Togetherall, which is a great resource. It's like social media, but anonymous, but it's a platform that students can log into, and it's a really safe space because it's monitored by clinicians 24/7. So no bullying, no hate, nothing like that. But they can connect with other folks that are on there, do creative things, learn about mental health resources, and get support that way.
That's good.
And
So
then,
lots of
and then
okay.
lastly, sorry, I'm so sorry, 988, because I always forget, like National Crisis Lifeline. You can dial 988, and you also, if you need to call or concern about somebody and they're not in the Memphis area, that is available throughout the United States.
That's good to know. 988, you said?
Yeah, yeah.
Okay, that's good to know.
And you
So
could call
parents,
the Tiger Care line too, but I like to give people that option. So it's
right.
901-678-2068, and it's option 2 after hours. And there's a phone tree.
All right, that's good. So, what kind of roles? I know you mentioned some of the things that could affect physical health and also mental health, but what roles do academic pressures, social relationships, lifestyle factors, what role do these play in student wellness? And when I say lifestyle factors, I'm thinking students may be getting, they shouldn't be, but they may be getting into like consuming alcohol, just maybe
Sure.
dealing with this with freedom that they never had, living with their parents. So how do these all play into student wellness?
So as far as all those things playing into student wellness, the student has to realize what they're here for. They're here for their degree. And we have to keep reminding them they're here for a reason. They're not here to, be distracted by all of the other distractions that can be here. Of course, distractions will always be there. You get this new sense of freedom. You're at the house, you feel like you can kind of do what you want to do. You might have get you a new girlfriend or boyfriend or stuff like that, get into trouble, but you have to realize what you're here for. Of course, the health center is here to talk to them and do any kind of testing that needs to be tested as far as that goes. And to kind of, handle those situations that might come up. Um, we're here to talk and give good advice, about how to handle that kind of thing. But they have to realize what they're here for, if I'm answering your question.
That's good.
Yeah. I think it can be hard, right? Because there is a sense of like, this is the last kind of stage of development for our brain too. So we're really figuring out our personality, our executive functioning, our high level, thinking. And because that's all like right in this age range, it can feel like, why does my student like not seem like themselves, right? Because they're exploring themselves as a young adult, right? And it's like literally like the last kind of bit until they're about 25, 26 is when the brain is like finishing developing. So if you're ever kind of like confused or like, I thought we went through this during their teenage years, like why are we having like so many changes? Like that's really why that a student really is like trying to figure out who they are and solidifying a lot of that. So that's why this time can be really pivotal, because a lot of these behaviors can really track you for how things are going to be after you graduate into your later adulthood too. So without putting like obviously too much pressure, I think coming at it from a place of like wanting to understand and be there with them and try to remind them like, yeah, like things can change, right? Like you get your degree and you may think differently later on, and that's okay. And that's like, how do we figure that out, right? Because it can feel like college boxes us in a lot, and sometimes it takes like, I don't have the answer yet, but I'm willing to help you figure it out.
Awesome. I love that. You may not know all the answers, but just being there, being a voice for your student, being there for them, that's all, sometimes that it takes.
Yeah,
Alrighty.
yeah.
So our next question is, what role does stigma play in students' willingness to seek help for their mental health concerns? And how does the college address stigma within the campus community?
I think there's a big stigma to like healthcare in general, right? Well, we know this. I don't just think this. And I think we're trying to do a lot to like reach all of our communities as well. Like I think access or mistrust of like systems like is a real thing sometimes. So and just concern of like who's gonna know, right? Like things have been punitive in the past of making people go get help or um labeling it. So I think how you approach it and how you talk about it really does have a lot of influence, right? So if mental health and like going to the doctor was not like a thing growing up, or you have like had like you got to model it too, right? It's a hard thing if you're not modeling it as a caregiver too. Like your student may not feel as comfortable with it because they still look to you for a lot of things. So that's one thing that we are trying to do is obviously have, I think, representation too, like people who look like you and can relate to you, I think is a big part of seeking help. And just that sometimes like you can switch, right? Like maybe you don't feel comfortable with this person. There's an ability to like find what you're looking for and like find that therapist and client match is a big huge portion of like client outcomes too, is like having that rapport is sometimes the most important. It is one of the foundational pieces for people to get the help that they need.
Yeah, and as far as like the health center goes, we have patients that come in with a lot of confidential information, and they might not really even want to tell us because of the stigma that might be attached to whatever they're going through or coming to us with. So we understand we're human. Everyone's human. Everyone has something going on with them. And, you come to a clinic or something for help. So the people that are here, we're not here to judge. We're not here to place any judgment or to sit back and talk about you, make make the student feel bad. We're here for a reason. And like I said, we're human too. We understand, we go through things. So as far as the stigma goes, it doesn't affect the way that we will handle student situations.
But it's a culture change that is in progress, and we hope it continues to get better.
Right. And it seems like it really is getting better. And just even outside of the campus community, just the culture in our country is seemingly more, trying to remove that stigma so that people can feel comfortable to get the help they need. So our next question, as parents, we want to support our student as much as possible, but are there boundaries that we should not cross? Like as parents, I'm sure some parents are like, there, I have no boundaries. But I think you kind of touched on it a little bit in one of your previous answers, but what happens when parents give too much support, or is there even a such thing as too much support?
Um, I don't know if there's a such thing as too much support, but then you can be kind of overbearing sometimes. And, a student coming from high school going to college, they're trying to, develop that sense of being that sense of independency away from their parents, not being so dependent on their parents. This is the time for parents to step back a lot bit, and let this young adult be a young adult and figure things out on their own.
Yeah.
Because after this step, they will be seen as an adult. Now they're young adults right now, 18 plus, straight out of high school. So it's that kind of transition of being, okay, you're my baby now, to, okay, seeing your baby as an adult, which can be hard. I have kids of my own, and I'm mentally preparing myself for that day when it comes. But, it's this is now the time to step back and maybe let them call you, maybe not call them so much, maybe not do certain things for them, let them develop their own habits. And then they'll realize, oh, I usually used to have my parents to do this for me. Now it's time for me to kind of develop this on my own. Let me see how I would like to do this. And hopefully the parents can sit back and say, wow, my baby is doing such a great job of, remembering the things that we have taught them.
Mm-hmm. Yeah, I think we forget sometimes that like when we're in the midst of learning, it's a struggle, and it's hard to see our loved ones struggle, but sometimes that means they're learning, like they're figuring it out. And if not everyone's going to get it right on the first time, right? I think we celebrate like very quick learners, or folks that can like perform like immediately, but we also can, let people get to that point, right? Because like you don't know necessarily when you see the A on the paper, did that take this person 3 hours to write? Or did it take this person 2 minutes, right? It depends. Like it's all within context. So actually, like sometimes it's hard, right? But like your kids got to tie their shoes at some point, right? So sometimes you got to watch them like literally struggle, and then it's like, aha, when they get it, like that's what you got to let them have that opportunity too, and don't take that opportunity away from them to struggle.
Awesome. Great input. So this next question is actually a little bit of like a situational question. So it says, my daughter has been dating a guy for about 2 months now and recently told me that they are in love and she wants to drop out of school and move in with him. I've also noticed that she's communicating less and gets very agitated when we reach out. I'm very distraught and worried about her well-being. What can I say or do?
In a situation like that, I mean, any parent doesn't want their child to quote unquote squander their future as far as, wasting it on a boy or boyfriend or girlfriend or anything like that. I think the best way to approach would be to let them know you will always be there for them. Anytime they need to call in the middle of the night, 1 o'clock in the morning, 2 o'clock in the morning, let them know that that line of communication is open for them. Sometimes telling them no, this is, you're ruining your life, telling them what to do is what sometimes I feel like that can be more harmful than good.
Yeah. I would agree too. Like, I think exploring more, right? So like oh, you love them and you want to drop out of school. Can you tell me why? Like you want to drop out of school and move in? Like, why does that like correlate, right? Like, can you not, have both? Like, can we like address this, right? Because there is like it sounds like there may be some like yellow red flags in this relationship, but you know, if she or they're not seeing that right now, that may not, stand out to them necessarily, but it could be, like just, perspective, right? Like we have those blinders on right now and we're, feelings of love and like the hormones around that can really like impede our decision making, right? So if you're still in that same age range, you're trying to figure out who you are and how you act in a relationship. Sometimes that competes with each other because we still one of our highest levels of needs is to be belonging and be accepted, right? And so the best thing you can do is then still accept them and still have them belong, in the relationship you have with them. But that's a tough situation. And sometimes I think, getting more perspective and more information, consulting about that can be later on, but like having the information ready of like, hey, this is what like a healthy relationship looks like. And these are kind of like some behaviors that are not so healthy. Like, is this happening for you? And exploring that with them can be good. We have part of our outreach, with one of the things we do a healthy relationships session every semester too. So I encourage you to like look up that time when it comes up and maybe mention it to your student that they can sometimes get extra credit for it to in some of their classes. So yeah, that's a tough situation and can hindsight's 2020, right? Like you may know because you've lived your life and your experience. Your student has not had that much experience yet. So sometimes remember context as well. Development context.
Right, right. Yeah, that is a tough situation. And I like what you said about keeping the communication open and kind of neutral. Because one thing you don't want your student to do is completely shut down or completely block you, because then you don't have that in with them where you can begin to ask those questions and have them really think and see. So those are some good points of advice for that situation. And if you're experiencing a situation similar or different and you need assistance or want to ask those questions, feel free to reach out to Parent and Family Services, or you can reach out to the Counseling Center or the Health Center, and we'll be happy to kind of give you some guidance and some tips and things like that. So don't feel like all is lost or you're only dealing with it by yourself. So just want to put that out there too. So our next question, what preventative measures or strategies can students adopt to maintain their well-being, particularly during final exams when we know stress levels at all-time high, everything's due, you're trying to study and finish strong. So what can students do? I think you mentioned one thing about breathing and some other things that can be done. So maybe reiterate some of those things.
I would say in the moment, definitely just taking some deep breaths, walking outside, looking at something else other than your books or your computer
screen,
or your
yeah.
paper or your notes. I would also say planning. So when I say planning, if you know you have a test in a month, start in small chunks. Just tackle this section first, this section next, and so on and so forth, so that you're not cramming the day before. You're not cramming the week before. So just chunking it off bit by bit, piece by piece, so that you're not having to do all of it at the last minute, I would say will tremendously relieve a lot of stress around test time. So when test time comes, you're like, okay, I just went over this. I answered all the practice questions over and over again. Because sometimes it's just a matter of answering the practice questions to know how those questions are worded so that you can answer them correctly. And that can alleviate a lot of stress as well, along with knowing the information.
Yeah, I think remembering there's no like right or wrong way. So I feel like people kind of get stuck with like sometimes it's just what is the best way right now to manage it. Specifically around finals, though, one, I really encourage everyone to keep up with the Parent Family newsletter. There's always some great information that Parent Family Services puts out around, honestly, any other time. So I think that's helpful. But specifically around finals week, the University Center Art Relaxation Zone's having their first birthday that Monday before exams. So make sure you tell your students to come by. We're opening up a couple more stations. You can get 45 minutes on the massage chairs that day as a birthday gift. Yeah. So just like a couple fun things. So that's on Monday. And then we're doing squish away exam stress. So we're going to be in the library doing some sensory items. And then we're giving away Thriving Through Finals kit on that Wednesday. So lots of things right before exams to prepare. And again, yeah, just like break it up. You got to take breaks in between things and be kind to yourself too, that sometimes it's just how we talk to ourselves is so important, right? So just because you get something wrong doesn't mean you're wrong. Just that question wasn't very good. And that, that's how I answered it in that moment. So we just have to be a little bit kind to ourselves. It's not about necessarily giving grace or giving a pass. It's not going to be helpful for us if we are being our, own worst enemy.
Could not agree more. I always like to say, like, be kind to your mind because, you are you and, no one else can take that from you. So, say you don't do the best on a final, you've still got another one that you can do better on. So definitely be kind to your mind during this time. Alrighty, our next question says, how can I help my student navigate homesickness or adjustment difficulties?
That can be tough, being homesick. I would definitely say send them care packages, have pictures, care packages and pictures, familiar items, things that, from their childhood, things that also always used to, make them feel better. Definitely phone calls. I wouldn't try to, call every day. Maybe a text message is all you can do. Voicemail, hey, I'm thinking about you. You're doing great. I'm always here for you. Just those kinds of messages I feel like can help combat homesickness.
Yeah. So I think, familiarity. Again, I think doing, this, just letting them know your presence. Sometimes you're just enough, right? Like, and being their cheerleader, I think is really helpful. We have a podcast too that I would, encourage your students to tell them to explore. There is an episode about, breaks and transition and whatnot. But there's a variety of topics on there. Sometimes it is just like connecting with a roommate, connecting with, somebody. And like, there's a lot of people on this campus and can sometimes feel like so overwhelming to find your group or find your people. But, reminding them that, like, sometimes sharing a story of what you've been through that like, it can get better. You can find your spot. But sometimes it takes a little bit to find your footing, and that's okay. It doesn't make you out of the ordinary or whatnot. It's just, got to fish through the sea sometimes. And I think keeping informed of what's going on campus is another helpful way, because there's so many students, and unfortunately there's a big chronicness of loneliness, right? Like we're seeing post-pandemic, students have a hard time connecting right now. Students have a hard time engaging. Where it's in a stressful time, so sometimes it's it's hard to connect and do those types of things. Again, Together All can be a good way because it's anonymous too, and they can connect on there and chat. At least as a starter, right? We love people getting in person and talking, but when we're talking about this generation, sometimes like that feels more comfortable for them too. So not poo-pooing it all the time, like making sure like hey, like you can try other things too. So
That's really good. I think the engagement piece is going to be important. Finding, getting involved with things on campus. Some students may tend to want to be in their room and isolated. But I think just getting out, even if you're doing things that your RA plans in the dorm or sitting with a classmate after class in the Tiger Den or something like that. Just, I think one step, once you take that first step, it gets easier. It
yeah.
gets easier. And so just encouraging your student to take that one step, I think will help them think less about home and more about, oh, I
Yeah.
have a new friend that I can talk to, or I have this group that I can be a part of. And I think that will help with the homesickness too. But that's a real thing. Missing
Yeah.
home and how, the routine used to be, or worrying about your family.
Mhm.
Parents, we tend to worry about our student, but there are some students that are worrying about their parents and their siblings
Yeah.
and grandma and grandpa, things that are happening at home that they're not there for. And so that's a real thing. So thank you all for those responses. Our last question is really more about the resources that you all provide, the support networks that are available for students and parents, really for parents to be informed so that you can let your students know. But what kind of networks and support systems are there on campus, and resources that parents can take advantage of or let their students know to take advantage of?
Yeah. So I would say everything really does live on Tiger Zone. So that is a great way. There's stuff going on all the time. Like some of the times it's like, I think overwhelming that about the possibilities. So I think that's real too. Just like I have too many choices. I don't know what to do. But the best thing I think when we talk about like trying to make a change or trying to make a new habit is prioritizing the showing up piece. Sometimes we talk about like the other parts, right, of our goal, but like we can't also work on those other goals without like the showing up, right? So even if we don't feel 100%, sometimes it's just like I need to just practice showing up and being there, just like going to class, right? Like it's not fun necessarily, but like once I'm there, like we kind of get into it. Sometimes like if we're like I'm really nervous about going to this whole meeting and whatnot. Sometimes it's just like, let's just practice like getting to the door and seeing how we feel. Or all these, student events going up. I at least walked to it and I tried. Doesn't mean that I won't get better later on, right? So sometimes like we have to think about engagement of just like getting people to show up first, and prioritizing and practicing that. Other resources. So Together All I mentioned, the relaxation zone I mentioned. I think there's just like a lot to be explored around the city too. So the iHeart Memphis blog is a great, resource for people to, utilize of like things that are free or near around campus. Choose 901, another great, source too. So I think just like knowing what's going around in the city too. The Audubon Park was recently revitalized. That's pretty close to campus, and you could take the Tiger Blue Line to South Campus to walk to the park too. So that's another just like nice thing for people, and people are always there exercising, connecting. The walking path's really nice. Those are like a couple other things that I was thinking about. I'll mention in a second like some events we have coming up too. That you can emphasize to your students. What else could we say for resources?
Now, as far as resources go, of course, the health center is always here. There will always be two providers most of the time here at the health center. Just as she was saying, there are also things there are off campus that you can get involved in, things that you enjoy doing, but maybe like you used to like to run, and you just want to get in the running club. There are running clubs, there are book clubs. Maybe you like to read, and join a book club, and you guys can talk about that book together. Just different things that are out there. And just as she was saying as well, sometimes the first step, you just kind of got to get over yourself, as hard as that may be, and just show up. You show up, enough times, something will happen.
Yeah. Yeah. Every unasked answer is a no, and any opportunity you don't take, is not going to happen either. So sometimes like outweighing that for yourself, I think can be kind of, scary, but that's, where, you can, the risk reward too of that, as well, without like other, parts competing with that. But I think sometimes it's, worth testing that out and thinking about that. Yeah.
Well, that's good. So that was all the questions that we had. Do we have any in the chat or anything, Kate? Okay. All right. Well, I don't know if you want to share the contact information. We've got about 4 minutes left
Okay.
in this recording.
So I'll share my screen again of the, y'all see that?
Yeah. Mhm.
Okay.
Relaxation.
So, like I said, all the things that are relaxation zones. So please emphasize to your students too. The locations I'll get to in a second. But it's a really pretty atmosphere of a space. Students that come at least 3 to 4 times see a significant drop in their stress scores. So we do check on them pre and post them visiting the services. So it's evidence-based, and students really help that. So this is just an easy thing too. It's like, hey, I heard about these cool massage chairs. Why don't you go check that out? And students really connect in there too. So if you're looking for connection and belonging, I've seen a lot of like friendships and connections be made there as well. So I think that's been something that I didn't expect from a relaxation zone program, but to emphasize that to your students too. This is the Tiger Care line. Like I said, after hour support if you need it as well. Sorry about that in the box too. So yeah, 901-678-2068 and dial 2, and you'll be connected to a crisis counselor. Togetherall.com, you can log in with the Student University login. It's free, it's anonymous. It's a great space for university students to really connect and get the support that they need. And here's all our contact information as well. So the relaxation zone, the counseling center, and the health center. I did want to emphasize to this coming Thursday, we're having our Collegiate Recovery Academy. So it's an alcohol and drug awareness, substance use, misuse training, as well as a suicide prevention training. There'll be free food. So if your students just even want a free meal, it's Thursday evening from 5 to 8 in the University Center. Our Tiger Zone RSVP students can RSVP on Tiger Zone. Wow. And that is all I had right now. Yeah, please. Also, I think Madison mentioned, like, if you can't think of making a care package for yourself, I know y'all at Parent Family Services have really cute ones. So definitely think about just taking the thought out of it and buying one of one of their great packages.
I was going to say, yeah, we have our finals care packages on sale now through November 24th. We do all the work for you. All you have to do is purchase it and include a nice, sweet encouragement note for your student that we print out and include with your care package. And we'll distribute those. Students will be able to pick them up. Actually, we partner with the Relaxation Zone. They can pick them up and check out the Relaxation Zone in December right before finals. I want to thank everybody for tuning in. I also want to invite you to our next Tiger Talk, which is going to be on well, in December. I don't remember the actual date. I'm sorry, but we'll be talking about the new FAFSA and financial aid. But we do these Tiger Talks all the time, so we'll have a new batch for you in the spring semester. And feel free to email us with any suggestions for topics. But we thank Victoria and Madison for joining us and for all the wonderful information they gave. Please feel free to reach out to us with any questions, and we'll get you connected with them. But we thank you for joining us for this Tiger Talk, and we will see you all on the next one. Have a great day.
Bye. Be well. Do you want to